The State Department of Health is investigating an outbreak of an infectious bacteria in the islands and are now asking for help from doctors. KITV4's Paul Drews has this new story at 10. Paul?
Well, an uncommon strain of E. coli has been found here in Hawaii, and it has sent some to the hospital. So the state sent out this letter to healthcare providers asking them to help keep track of this outbreak.
Normally, there's harmless E. coli in our intestines, but sometimes the bacteria can cause people to become ill when it's outside of our digestive system. Those types of cases do occasionally occur here. But sometimes outbreaks happen. 3 years ago, an E. coli outbreak that sickened 7 people was traced back to a Honolulu restaurant.
We generally know or identify at least maybe 1, maybe 2 cases a month. So to have like 6, 7 cases within a month, it is unusual. It means it definitely is like a red flag. There is something going on.
This time, 5 children and an elderly resident tested positive for the sickening strain of E. coli. And according to the state's letter, no source has yet been identified for this current cluster. 3 of those cases were severe enough that patients had to be hospitalized, and 2 of those developed a potentially life-threatening complication. So in the letter, the state is asking doctors to consider the current cluster when evaluating patients with symptoms. Those symptoms include severe stomach cramps, diarrhea, vomiting, and usually just a mild fever if there is one at all.
Now, E. coli is usually associated with contaminated food or water, and while anyone can become infected, very young children and the elderly are more likely to develop severe illness and are at greater risk for those life-threatening complications.